About 1 in 4 Americans with dementia are still being prescribed medications that act on the brain and nervous system. Good evening, guys. I have your discussion seed for tonight. We're discussing medications prescribed to dementia patients that alter their brains and such. So let's get into the presentation, please. Okay, the headline warns about 1 in 4 older Americans with dementia are still being prescribed medications that act on the brain and nervous system, even though those drugs are linked to increased risk of falls, risks such as falls, confusion, and hospitalization. What the phrase brain altering means. Brain altering meds on the page refers to several classes of central nervous system or CNS active drugs, specifically antidepressants with strong anticoagulant effects, antipsychotics, barbiturates, benzodiazepines, benzodiazepines, hypnotics, and Z drugs. These can cause sedation, slowed reaction time, dizziness, and worsened cognition in older adults. What the study found and why it matters. Researchers analyzed Medicare free for service prescribing data from 2013 to 2021 and found that although prescriptions for these CNS active drugs fell overall from about 20% to 16% in the broader sample, nearly 25% of older adults with dementia still receive at least one of these medications. That matters because people with dementia are more vulnerable to side effects like increased confusion, sedation, aggression, dependence, withdrawal, and a higher risk of falls. And hospitalization outcomes that can accelerate decline and harm quality of life. What clinicians and caregivers are advised to do. The article highlights expert guidance that These prescriptions may sometimes be appropriate, but they should be used cautiously. It recommends reviewing the needs reviewing the need for CNS active drugs with the prescribing physician. Considering alternatives for behavioral or sleep symptoms when possible, tapering or stopping medications that are inappropriate or causing harm under medical supervision. The headline reports a key finding from a UCLA analysis. About 1 in 4 Medicare beneficiaries with dementia were prescribed central nervous system active medications that are linked to harms such as falls, confusion, hospitalization, which drugs are meant by brain altering. The article groups these risky medications as 5 classes: anticholinergics, antidepressants, antipsychotics, barbiturates, benzodiazepines, and non-benzodiazepines, hypnotics. Sleep drugs or Z drugs. These drugs, these drug types can cause sedation, slowed reactions, dizziness, and worsened cognition in older adults. Key study findings: research linked health and retirement study survey data to Medicare free for service claims from 2013 to 2021 and compared prescribing across people with normal cognitive impairment without dementia, and dementia. CNS active medications were prescribed to about 17% of those with normal cognition, 22% with cognitive impairments, and roughly 25% of people with dementia. Overall, prescribing fell modestly over the study period, driven mainly by declines in benzodiazepines and sleep drugs. Why this is concerning: people with dementia are more vulnerable to side effects of these medications, so prescribing them at higher rates raises safety concerns. The study also found by 2021 over 2/3 of patients receiving these prescriptions lacked a dominated, a documented clinical indication. Suggesting many prescriptions may be inappropriate. Study limitations and contexts. The author's note limits. The analysis used Medicare free for service data. Only Medicare Advantage data were not available. It may miss clinical details such as agitation that could justify some prescriptions, and it measured prescribing prevalence rather than total cumulative exposure. These uh, these convey meaning. The numbers are informative but not a complete picture of clinical decision making. Practical takeaways. The article's experts emphasize that some CNS active prescriptions can be appropriate, but they recommend careful review with clinicians, consideration of non-pharmacologic alternatives for behavioral or sleep problems, and supervised tapering when a drug appears unnecessary or harmful. Medications that increase fall risk in older adults. Core message. The article emphasizes that 9 categories of commonly prescribed medications can significantly increase the likelihood of falls among older adults. These drugs affect the central nervous system or cardiovascular system, leading to side effects such as sedation, dizziness, blurred vision, confusion, or sudden drops in blood pressure. For seniors whose balance, balance reflexes and bone strength are already more fragile, these effects can turn a minor stumble into a serious injury. The 9 drug types and their risks. Antidepressants. Tricyclic TCAs, and certain SSRIs are singled out because they can cause dizziness, arthritic, hypertension, blood pressure drops when standing, and anticholinergic effects that impair cognition. For older adults, these side effects can worsen confusion and destabilize gait. Sleep medication, Z drugs such as zolpidem, zolpidem, and Ambien, and estrozepazole, uh, lunesta, are widely used for insomnia. They often cause next day drowsiness, slowed coordination, and impaired judgment, raising the risk of nighttime falls. Anti anxiety medications. Benzodiazepines like lorazepam, Ativan, and diazepam Valium are known for sedation and slowed reflexes. Long-term use increases dependence and magnifies fall risks. Muscle relaxants such as methocarbamol and cyclobenzodiazepine are prescribed for musculoskeletal pain. They can cause drowsiness, blurred vision, and confusion. Making safe movement more difficult. Anti-seizure medications. Agents like carbamazepine and gabapentin are used for epilepsy or neuropathic pain. They frequently cause dizziness, balance problems, and double vision. Antipsychotics, medications such as Haldol or uh, Risperidone can produce sedation, blurred vision, and minor side effects like tremors or rigidity. These effects destabilize gait and increase fall risks. Pain medications, opioids like Oxycontin or oxycodone and hydrocodone slow cognition, impair motor skills, and cause dizziness. They are strongly linked to falls, especially when combined with other sedatives. Blood pressure medications. Antihypertensives can cause low or fluctuating blood pressure, particularly after dose changes. This leads to lightheadedness, fainting, and falls. Antihistamines. First generation antihistamines, such as diphenhydramine or Benadryl, are sedating and impair vision. They are considered inappropriate for older adults because of their strong anticholinergic effects. Why this matters. The article underscores the scale of the problem. Folks, this is an easy comparison. Okay? You give somebody that's let's say for example, you give somebody with dementia one of these drugs, they fall. Their frequent falls are due to the medications. If somebody is trained in the knowledge of medications and for falls and such, you can do a a gait study for those kind of people and see if it's affecting their gait. If they're confused more because of the medication, it's easy to tie to if you take the time to do so. But again, if you give a person with dementia one of these sedatives or one of these sleep medications, the side effects are compounded. They just make it worse. They don't fix the problem, folks. With that being said, this is tonight's show for everybody. I will see everybody tomorrow for shows. Until then, Gator Wellness. Take care, folks. Have a good night.